We continue with shame, second part, still on the emotions in Chinese medicine. Shame is inwardly directed. The objects of shame are one's own actions. It is dictated by moral criteria and has a negative evaluation. One is responsible and blameworthy. As in anger, shame involves a courtroom mythology of law and judgment, accusation and punishment. In shame, unlike anger, one casts oneself in the uncomfortable position of defendant rather than judge, but a defendant who has openly admitted to his crime and is willing to accept punishment for it. Shame is inwardly directed and it therefore makes chi stagnate, but also possibly sink. Indeed, sinking of chi is a frequent result of shame. Dampness also frequently accompanies shame. When one feels shame, one feels dirty, and dirtiness is characteristic of dampness. So here we see the clinical picture of shame. There is prolapse, chronic excessive vaginal discharge, chronic menorrhagia, chronic slight urinary incontinence. Shame often manifests with sinking of qi and dampness. For example, prolapse of organs, chronic and stubborn vaginal discharge, chronic excessive menstrual bleeding from sinking of spleen and kidney qi, and chronic slight urinary incontinence. So shame can cause both qi stagnation and qi sinking. Qi stagnation of the heart, spleen, and kidneys, and qi sinking of the spleen and kidneys. All will result to dampness. In summary, shame is a common emotion in Western patients. It may be caused by a feeling of shame about one's behavior, but more commonly, it is an inborn feeling of shame due to one's upbringing. Shame is overwhelming and is self-demeaning, extremely defensive and impotent. Shame is related more to one's place in society, what people think of us, the feeling that one has to hide because one has done something wrong, something that society frowns on, something dirty. By contrast, in such situations, we would feel guilty even if nobody sees us doing something wrong. With guilt, we hear a voice condemning us. With shame, we see people condemning us. Shame is inwardly directed and it therefore makes chi stagnate, but also possibly sink. Indeed, sinking of chi is a frequent result of shame. Dampness also frequently accompanies shame. When one feels shame, one feels dirty, and dirtiness is characteristic of dampness. Thank you for your attention.